It's somewhat expected. When technologies emerge, oftentimes there's always a little bit of a resistance, right? And we've seen technologies around telehealth for several decades now, and all of a sudden the pandemic happened, and people were like, "Oh my God, we've had this technology. Let's start integrating that into care delivery." And the implications and the learnings from that is that, wow, we should have done that years ago. It worked so well. Why can't we have part of care delivery being virtual and the rest being kind of more traditional? And I think over time, telehealth and other technologies start to become part of care, right? It's not so much a different solution anymore. It just gets integrated into care delivery. And oftentimes, in order to provide good care, you've got to find ways to reduce the cost of it. So you can't always have two different modalities, one traditional and one virtual. At some point, you have to merge those. And I think this is the result of that. I think governments and policymakers are realizing, well, in order to make care still affordable, we need to kind of bring in some of these solutions into the whole package. And so we will see that with other technologies as well. But this is somewhat expected as technologies and care delivery solutions evolve. I think if you think about the major stakeholders around the adoption of telehealth, you've got from, I would say, top to bottom, you've got states, right, and agencies who have to figure out how do we make that part of services to our populations, and how do we get reimbursed, and how does it work from a transactional and economic standpoint. You've got health systems who have to adopt that, and within the health systems, you've got the actual people, the physicians, who have to figure out, well, if I'm going to spend so much time doing this and that, I mean, this can be distracting. Am I comfortable with technology? How do I put that into my daily workflow? If I have to see patients, you have to make operations and procedures, and if on top of that, I've got now to carve out some time for virtual care. And so the adoption for physicians is actually important. And I think that's been one of the big obstacles in the past, is the comfort around that. And then, of course, the most important stakeholder is the patient and their willingness and comfort level with that. And again, I think the pandemic has kind of thrown all of that into our face. We're like, okay, if you can't go to the hospital, if there's just not room and time, and you've got to do it from home, from the comfort of your home, and you just have to adapt. And I think both patients and providers have been forced to adopt these solutions, and have realized that there were actually a lot of pros in that. And why go back to old ways when we can continue to do this? So I think looking at it from a stakeholder's perspective has really, helped us evolve our thinking about telehealth. And even when you think about telehealth, for example, right, there's a catch-22 to it, right? Because you think that technology is a great equalizer, and in some ways it is, right? Because now people who usually don't have access to to care, all of a sudden through technology can do that. But at the same time, and I don't have the exact numbers, but at the same time, it creates separation and disparity, right? Because, for example, and this is just a simplification and an assumption, but you could imagine, like, the elderly population not feeling comfortable with technology use, and not being able to use telehealth in the same way as other generations, or maybe younger people. Again, that's an assumption. Not all seniors have these difficulties, and sometimes there's other forms of support to help that. And even when you think of certain vulnerable populations or underserved populations, it's one thing to assume that they all have smartphones, but they may not, right? And without a smartphone, you may not have access to Zoom and video calls, et cetera, et cetera. And so I think technology has, and firms like us who are backing solutions that are kind of tech driven help to alleviate some of these challenges, but we have to be very thoughtful about how our best intentions in leveling the playing field for vulnerable populations may in fact isolate subgroups of these. And so we at 3CC, we really think about care delivery, right? And through our framework of care delivery, we're thinking about the quadruple aim, which is how do you improve outcomes? How do you reduce the cost of care at a systems level? And how do you improve the experience of care for both patients and providers? And unfortunately, you can't win them all. You would have to have an incredible technology or solution or product or service in order to really fulfill these 100%. And so we want to be thoughtful about which populations are the most vulnerable, and is this addressing that solution? And if it doesn't address that solution completely, can we think of certain partnerships, or can we find complementary technologies and companies that can address the gaps? And over time, as I'm building the portfolio of companies at 3CC, I try to create that Venn diagram that somehow makes it better for as many people as possible, and not just in the US but globally. So you have to be realistic about the limitations of what you can do, but I think it's important for organizations like ours and other funds and other enterprises to really start being intentional about care delivery for underrepresented communities. And the more of us out there are contributing to that, the better it would be in terms of health equity.